Namaste everyone. I am Dr. B. Tulsi Satyendra, working as a consultant pathologist at Quantum Specialty Diagnostics. Today, here I am to discuss with you about one of the most prevalent cancers among men, that is prostate cancer. The talk would be outlined on the following topics like what is prostate gland, where is it situated, what is its function, and what are the symptoms of prostate cancer, who are at risk of developing a prostate cancer, and what are the tests and further evaluation to be done to detect it at the earliest, and what are the treatment modalities that are present. So, to begin with, what is a gland basically? It is a walnut shaped gland which is present at the base of the penis just below the urinary bladder. Its function is to provide some secretions that mix up with the semen and is helpful for the sperm to carry on its function. And the basic thing that develops in a patient with prostate cancer, the symptoms that he may feel is painful passage of the urine, that is dysuria, that is pain during voiding of the urine, sometimes blood mixed urine, and also there might be some patients who may present it with erectile dysfunction, that is inability to perform the lovemaking while because of the erectile dysfunction. And also there might be some patients who may complain of reduced streaming of the urine. These all things happen because the prostate gland, because of its location, also is nearby to the ureter, that is the tube through which the urinary bladder and the urine comes out. So it may get compressed because of the enlarged size of the prostate gland and thereby producing these symptoms. So these are the warning signs which the patient should keep in their mind. So in general, who are the population at risk? Usually it is considered a cancer of old age, and mostly it has been found that 60% of the patients are above 55 years of age. So the screening modalities that are advised are serum test, that is blood test for prostate specific antigen. It is a protein which is secreted by the prostate gland and that can be detected in the blood, and if it is beyond a normal value, then it is suspected to be having some pathology at the prostate gland. Now, the elevation in the prostate specific antigen, that is PSA, could be because of infection also. It could be because of the inflammation of the gland also, or as well as because of the increase in the size of the gland also. It may cause an increase in the serum prostate specific antigen levels. Also, along with that, prostate cancer being one of the causes. So it is not necessary that an increased PSA levels means a sign for prostate cancer being developing. It is not always so. So thereby, whenever one has an increased levels of PSA, they should discuss with their clinician what should be the next modality of approach for diagnosis or further evaluation to be carried out. So the next step usually is an imaging test in which ultrasound abdomen, or more specifically a transrectal ultrasound is being done, and at the very same time a biopsy may be taken if an prostate is found to be enlarged. So at that time specific areas, multiple areas have been targeted, and then biopsy is being taken, which is then examined by a pathologist for looking at the pathology what is going through in the prostate. Apart from that, apart from serum prostate specific antigen, that is PSA, in research few other markers are also available, like one being detection of PCA3 in the urine, but it is at the research level, not yet in diagnostics. So these are all pertaining to the diagnostics which need to be taken, but we should also be aware who are at risk and what are the things that may lead to prostate cancer. So as far as diet and lifestyle habits are concerned, there are no specific attributes that have been given, like any particular diet has been attributed to causing prostate cancer. It is not so. But however, it has been found that obesity has been linked to increased association with prostate cancer, as well as uh, weight gain is also associated with prostate cancer. Then another risk factor which one must keep in their mind is that possibility of inheritance. Though prostate cancer is not considered to be a cancer that is inherited, but because of some germline mutations, it might lead to increased tendency of causing prostate cancer in a particular family. And to get to know about that, we should keep these things in mind. Like if there are first degree relatives like father, son, or a brother who are getting affected with the prostate cancer, then the concerned person should get himself tested for prostate cancer, or for screening, should undergo screening for prostate cancer. Similarly, if three or more relatives among the same lineage of the maternal side or of the paternal side are developing prostate cancer uh, within the three successive generations, then the person should be cautioned about undergoing screening for prostate cancer. As well, the third group of population who should be more concerned would be if two or more of the close relatives develop prostate cancer before the age of 55 years of age. So these are the three population groups who should be concerned about getting themselves tested for any prostate abnormality. So apart from that, any affiliation with dietary change, it is not being associated, as I have already alluded to. Apart from that, if we come to the diagnostics purpose, then after the serum PSA levels, the clinician usually takes biopsy of the prostate gland by transrectal ultrasound guided biopsy, and then the pathologists examine it under the microscope, and they give it a report if there is any suspicion of malignancy, or if there is a malignancy. Then they give the report in the format of Gleason scoring, which tends to state the differentiation of the tumor, by which I mean that whether the tumor is more resembling to a healthy tissue that is well differentiated, or is it somewhat very much representative of a healthy tissue but not certainly healthy, that is moderately differentiated. And if it is very much not related to the healthy tissue, then it is called as poorly differentiated. And the Gleason score which has been given is 6, 7, 6 for well differentiated prostate cancers, and 7 for moderately differentiated, and 8 or 9 or 10 for a poorly differentiated prostate cancer. So why is this important? Because this gives the clinician a clue what about the prostate cancer's behavior could be, because it is not the standalone parameter on which the clinician will base his treatment. They will consider the stage of the tumor as well. By stage, I mean the extent of the spread of the tumor that has happened, and also certain other prognostic factors, like whether the prostate cancer has involved any nerve, or does it has entrapped any nerve, or does it have any peculiar features that we examine on microscopy and will be including it in the report if we found them. So based on all these parameters, the clinician would decide upon the further treatment. Along with that, they will carry on the imaging studies to determine the stage of the tumor, and by which the probable operability of the prostate cancer, or even the active surveillance, that could be one of the possible alternative that can be given to the patient. By active surveillance, one means that though in some patients who are at low risk, or those who are having a low grade of prostate cancer, or those who are not at present having any symptoms can be watchfully observed for the progression of the disease, and if on a later stage when the symptoms develop or they worsen, then they can undergo an active treatment. So because of the pros and cons of treatments, active surveillance could be one of the modalities of choice, and that to be discussed with the clinician. So, so for active surveillance, one recommendation is to undergo serum PSA level estimation at every 3 to 6 months, and if required, or digital rectal examination could be done once in a year, but it is not that much recommended. And to undergo a prostate biopsy within 3 to 6 months of the initial biopsy, to be followed by 2 to 5 years if required later on subsequently. So after this, the treatment that options that are available with the patient are to undergo a surgery, or to undergo radiotherapy, or to undergo a chemotherapy, or some hormone replacement therapies are also available. Sometimes after undergoing these treatments, the symptoms definitely most of the times do get reduced, and also the prostate cancer may get cured. Sometimes in some unfortunate cases, the those after the complete though after the cure of the prostate cancer, it might happen that their prostate specific antigen, that is serum PSA level, during the follow-ups might still get elevated. This is called biochemical recurrence of a prostate cancer. So, so that's why here comes the value of having a follow-up prostate specific antigen or serum PSA level estimation during the follow-up period, even after the treatment for prostate cancer. So these are the few points that I wanted to highlight, and to keep all the people aware of it, that prostate cancer doesn't get cured by undergoing chemotherapy or surgery alone. It needs to be followed up because there are chances of getting recurrence, that is biochemical recurrence, even after the cure of the primary cancer. Hope this information was valuable to you all, and I pray everyone's health and cheerfulness. Till the next upcoming video, I'm telling you goodbye. Thank you.